Our poster today discusses the benefits and potential improvements in implementing CCAs, an abbreviation for co-curricular activities, in an academic program. These activities are implemented by programs to complement not only the formal didactic learning, which is a guided learning between student and teacher in a controlled instructional setting, but also experiential learning, which is considered a more hands-on approach on teaching. These activities happen outside of the formal curriculum and are presumed to enhance student knowledge by improving their interprofessional skills, integrity, and coordination. Many CCAs expand upon information already learned within a classroom setting, but they do allow students more autonomy within professional settings because they are unmediated by professors. Prior to the 2018-2019 school year, CCAs were never reported in Xavier's pharmacy program. This resulted in a lack of documentation on the impact that they made in a student's learning experience outside of school and how their voluntary work helped communities. Beginning fall 2018, Xavier's pharmacy program required students to complete at least 3 CCAs and document them in Pharm Academic. This differed from prior years because they became mandatory activities. These CCAs were expected to link foundational knowledge to real-world practices.
Our presentation will focus on the different types of co-curricular activities completed by students in the pharmacy program and the impact made from making the report of these activities mandatory. Lastly, we will discuss revising the definition and classification of co-curricular activities. The data used for this presentation is based on the 2018-2019 academic year. Students were classified according to academic level in the 4-year pharmacy program: P1, first year; P2, second year; P3, third year; P4, fourth year. Co-curricular activities were classified into 3 categories: professional health services, community and college engagement, professionalism, and leadership. Professional health services are activities related to students providing patient care. Community and college engagement are activities related to delivering services to the community. And professionalism and leadership are activities related to career development.
In total, our data shows that 445 out of 579 students reported their CCAs in Pharm Academic for the 2018-2019 academic school year. This was a 77% participation that was demonstrated within the pharmacy program. This participation consisted of 140 first-year pharmacy students, 122 second-year pharmacy students, 109 third-year pharmacy students, and 74 fourth-year pharmacy students. This graph illustrates the different type of activities reported under the professional health service category. It also shows how many students from each year participated in each activity. This CCA category involves students participating in health fairs and providing community health services such as medication reviews, nutrition education, blood pressure screenings, and health information distribution. The Latino Health Fair is one of the largest health fairs in the New Orleans area. Over 50 Xavier pharmacy students volunteered, and over 350 attendees received free medical services in 2019. Activities such as these provide students with an abundance of knowledge that relate to how to professionally interact with patients and other healthcare professionals in a setting that's outside of school. Students learn in the pharmacy curriculum through lab activities how to take a patient's blood pressure. Through CCA, students apply and practice these skills on real-life patients. Prior to mandatory documentation of CCAs, the impact that Xavier's pharmacy students made within the Latino community would go unnoticed in the pharmacy program. It's also very important to note that many students participate in more than one health fair or any other professional health service activity per semester. However, they're only allowed to document one. This vastly limits the information the pharmacy program would be able to use to properly assess a student's professional growth.
This graph illustrates activities completed by students in the community and college engagement activities. In this category, 49.9% of pharmacy students volunteered in community activities such as painting houses, cooking meals for homeless, conducting donation drives, and cleaning public areas. The categories within community and college engagement are broad and unclear. Although only 40 students reported participation in cultural awareness, more than 100 students participated in cultural night. Categories such as advocating for patient and community issues had the least amount of student participation, with only 4% of pharmacy students. Advocating for a patient's behalf is a very important part of becoming a well-rounded and developed pharmacist. Advocation should be as emphasized outside of the pharmacy curriculum as it is within. Community and college engagement clearly show which skills students can demonstrate an improvement on. A lack of participation can correlate with a lack of experience that can be helped through program intervention.
This graph illustrates the different type of activities reported under the professionalism and leadership category. It also shows how many students from each year participated in each activity, like the other graphs do. Documentation of CCAs can prove very helpful to academic programs, not only by properly assessing a student's personal and professional growth throughout the program, but it also provides useful information that schools can utilize to enhance student participation in activities outside of their curriculum. For example, this graph shows that roughly 27% of students attended an educational or legislative event. This information indicates that a good portion of students prefer this activity, and the school could implement more seminars for students to attend in the future. Although documentation could be very helpful, this category is riddled with unclear and overlapping classification of activities. This could hinder its usefulness. For example, a student attending a career preparedness seminar could also consider this seminar to be an educational one. This activity would then be classified under two different categories. Another example would be if a student considered a student peer program as a professional pharmacy program. This could also result in an incorrect classification of this activity. By avoiding student confusion and implementing a more transparent and cohesive way of classifying things, information that would be more useful and accurate for the pharmacy program would be obtained. This graph is a continuation of the graph prior on the professionalism and leadership category. This graph also further indicates that a revision, potentially merging or broadening classifications, is highly needed to yield more effective data. This graph also shows us that roughly 9% of Xavier Pharmacy students participated in research projects or presentations. Research experience is a key aspect that residency programs look for in students, with many pharmacy students showing an interest in entering residency programs after graduation, and Xavier also emphasizing careers outside of retail pharmacy. This information could be used as a sign to create more opportunities or broadcast outside opportunities for students to participate in research. This information could also indicate that only 9% of students reported this as their activity for the assignment. However, one cannot decipher this because only one activity is allowed to be reported by a student for each category. This again limits useful information for the school. This slide provides a summary of the results and graphs discussed throughout this presentation.
Co-curricular activities should be mandatory as it provides data and the ability to be able to analyze the impact of co-curricular activities in students' growth. Co-curricular activities are activities that are completed outside of the formal curriculum, yet students document activities that occur within courses. This shows that a refined definition of co-curricular activities is needed to prevent incorrect documentation from students. For example, in the professional health service category, 56 students reported activities that were conducted as part of a formal professional practice course. This is inconsistent with the definition of co-curricular activities and indicate that these students might have not participated in any activities outside of the curriculum to help their growth. Students also documented the same activity in different categories. Although an activity can prove to be beneficial in different aspects of students' growth, a revised way of classifying each activity would prove more beneficial in collecting and assessing students' data. Overall, based on our results, we recommend a revision of the definition of co-curricular activities in their classifications. We also found that documentation of these activities can provide the school useful knowledge of ways to improve its students' personal and professional growth outside of their own curriculum. Student participation in activities can highlight their interests or dislikes. Students should be allowed to report more than one activity per category and not be limited.